My name is Tasha Dewald, and I'm going to talk about how I meet the NLN core competencies. The first core competency is facilitating learning. According to Bradshaw and Lowenstein, teaching and learning strategies at the participation level requires recurrent thinking so the students can build on their learning and go beyond the basics. In health assessment, I demonstrate how to do the health assessment of the review of system that we're working on, and then the students practice on each other. And when they do practice on each other and fill out their worksheets to review the systems, I give them some abnormals that they're going to find. So it's not just normals that they're finding, and that requires them to critically think. I also use some cartoon little ways to help them remember different things, because I know everybody learns differently, and so I provide different ways for each person to learn, or a variety of ways, so that hopefully one of the techniques will trigger in their brains. I also use case studies and then some of my real life experiences that I've had, and then we also use simulation. In Foundations of Nursing, I do some art projects with the schematic model and then the philosophy of nursing. Then they also do a nurse theorist project. And then in my legal class, I incorporated study mates where they can do fill in the blank, matching, or word find that will help them review for the test. Core competency number 2 is facilitate learning, development, and socialization. And with this, I want the students to engage in professional behaviors. So when they are in health assessment in the lab, it's just like a clinic room. They're going to come to the door, they're going to knock, they're going to wash their hands, and then they can practice their review of system or practice their checkoff that they are going to perform. Competency number 3 is use assessment and evaluation strategies. With this, I do flipped classroom, and I do the flipped classroom in my Foundations of Nursing. When they do their nurse theorist project, they present to the class and they have a partner, and when they have the partner, then they need to evaluate their partner on the effectiveness of doing the teaching project. And then health assessment is also an evaluation process when they do their final checkoffs for health assessment. The competency number 4 is participate in curriculum design and evaluation of program outcomes. I focus on the outcomes and meeting them in all of my courses. And then in health assessment, I use current techniques and use current articles that I find that relate to the system that we're working on. And then I also educate the students so that they know that percussion isn't something that is highly utilized today because of the advance in technology, but it's still something that they need to understand. Competency number 5 is function as a change agent and leader. I helped in the curriculum evaluation committee when at the beginning revising the curriculum, and at this time we had student involvement. We used student feedback to help with the process of that. And then I also try to use a lot of evidence-based practice during my lectures. Competency number 6 is pursue continuous quality improvement in the nurse educator role. According to Billings and Halstead, teaching strategies are effective if evidence links teaching with student learning. So I try to change up my teaching style to adapt to current generation of students and the advancement of technology, because in Bradshaw and Lowenstein, they talk about how educational technology continues to grow with leaps and bounds, changing the world of education. So we always have to develop or utilize new methods of teaching to engage the students and utilize the technology that they're used to in this generation. I'm also on the evaluation committee, and we evaluate the tests, and then we give the feedback to the instructors so that they can adapt the test and make sure that they have enough knowledge level questions, evaluation, assessment, or application and analysis style questions also. Competency number 7 is engage in scholarship, and at this current time I'm not working on publishing anything, but once I'm done with school in May 2015, I have a goal that I want to publish, and I want to be involved in research and publishing articles. Competency number 8 is function within the educational environment, and I engage with a lot of faculty that are seasoned, and I realize and try to utilize all of their teaching strategies that I'm learning, especially this semester, being in their classrooms and listening to them. I want to engage. And then I'm also involved in department university committees, And then I'm also involved in the community organization for Kiwanis, so I try to stay involved in a variety of different areas. And thank you for listening to my NLN core competencies.